Welcome back to the show. Heidi Lubetkin from the Community Renewal Team in Hartford is here to discuss a $1.5 million federal grant to help tackle the opiate problem. Welcome, an important organization. Thank you for coming on.
Thank you for inviting us.
So what are we going to do with this problem? Hartford has one of the highest rates of opiate overdoses in the state. Number 3, I believe, in the state, and Connecticut is in the top 10 in the country,
correct.
right?
Yes.
This is a bad, profound problem.
It is.
Why is CRT on this?
Absolutely. Well, first and foremost, thank you for inviting us to come and talk tonight. And so CRT is your neighborhood community action agency located in Hartford. And what we do is to really participate in making sure that we fill the gaps. And obviously, in looking at the statistics, the opioid epidemic is definitely a gap fill that we need to do. And so we applied for through SAMHSA, the Substance Abuse Mental Health Services Administration, to find out if we can enhance and expand what we currently provide in the communities. CRT owns and operates 3 behavioral health clinics already in Hartford, all 1.5 miles from each other.
So you see the problem firsthand.
Absolutely.
You see down there on the ground there.
Absolutely.
So,
people come right into our services every day.
So how does money help? Because the opiate issue, if you trace it back, it starts with someone abusing prescription drugs at some point, and going from there to the opiate situation. Not necessarily all the time, but at some point there's an introduction to someone's dealing with pain, they're on prescription drugs, the drugs end, they find some other alternatives, and they go to the opiates. So how do you stop that sort of need to go to the opiates? What can be done to stop it?
We have to meet people where they're at, wherever they are, in whatever situation they're at, with no judgment. And CRT's opening the doors to do that. So with this grant, with this $1.5 million, we're going to be able to tackle this with an expansion. We currently provide those services in our behavioral health clinics at 330 Market Street in particular, but now we can expand by enhancing the medications that we can provide, particularly with Suboxone, and having also...
So what is that? So that's a
Suboxone is a medication that will help with the cravings and with the addiction for either the prescribed opioids that people obviously get addicted to, or unfortunately the illegal drugs that people unfortunately get addicted to as well.
You know, one thing I found really interesting with this whole issue is that we look to blame sometimes society. Where does this problem come from? Is it the manufacturers? Is it what this, that, or the other? It seems to me, and I said this before, we had a doctor out here, Dr. Craig Allen, the doctors have to share the large chunk of this blame, right? Absolutely. They're the ones prescribing these very toxic painkillers. And I didn't realize, Dr. Allen told me this, doctors are not trained in pain management. No. They have no experience in that. They basically, it's kind of a trial situation. They give it to you and they get good feedback. They give it some more because they're saying, well, the end evidence is that they like this, so we keep giving it, but they aren't really trained in how much to give. Kind of trial and error. I found that to be startling.
Well, think about when you go to the doctors, right? You go to the doctor with a symptom or an ailment. The doctor's not there to do much then to help with that symptom or with that ailment. And so we do those things not necessarily in a preventative manner, right? And so we have that symptom and we put a medication on it and hope that that resolves it. And in some cases, maybe a short-term medication can help to resolve that. But unfortunately, it has an addictive, absolutely.
Yeah, because the idea is you want to try to help the patient, take them out of pain, but sometimes by taking them out of pain, you're exacerbating the problem. I think this is where this opiate issue is. So when does it start? We have about 15 seconds. When does the money come in? And what's the first 2 things you're going to do? 2 specifics. In about 15 seconds, break us down. What do you want to do?
Absolutely. So the money's here. We're open.
You're ready to go.
And we're absolutely, we want to help people change their lives each and every day. And so anyone can drop in at 330 Market Street or call us at 860-761-7900. Come in the door and say, I need help.
Okay, you're also dealing with ex-offenders as a key population.
Absolutely.
Those coming out of prison.
Absolutely, and we have HCC down the street from us, Hartford Correctional Center. We also work with state and federal corrections. We want to help men, but we also want to help women.
All right, thanks for your time. Heidi Lubetkin from CRT. Thanks for your time. Don't forget to catch our show on your own time. Fox61.com/Stan. Friend us on Facebook. Follow us on Twitter.